Welcome everybody to the Public Health and Safety meeting. We do have a quorum. We have 8 or 9 so far, so we're well within the quorum. We'll go ahead and call the meeting to order. I'd like to approve the minutes of the April 24th meeting. I know it was a while ago, but anyone have any comments or anything? Going. All in favor?
Aye.
Okay, I'm assuming that's unanimous. Okay, so the next topic is to discuss and vote on appropriating $78,554.50 from the opioid legal settlement to fund various town of Darien program expenses consistent with the purpose and intent of the opioid legal settlement. Mindy Chambrelli, as Director of Health, is on the call with us, and she will provide an overview and hopefully we'll have some good questions for her. So, Mindy, if you could just take a few minutes and walk us through.
Sure. Thank you for the invitation, Matt, and also for your role in the Public Health and Safety Committee for the RTM.
Okay.
So Mac asked me, well, first of all, I'll introduce myself because I have not met some of you. I am not new to the town of Darien. I have been here for 11 years in April and recently was promoted to Director of Health effective July 1st. So some of these things I'm going to talk about that where we've committed money thus far was under the previous leadership of David Knopf and some of the boards and committees that he was part of at that time. I'm open to questions. Let me just give you a little bit of overview about the special appropriations and the full amount that we've received to date, which you can see is $78,554.50. And the purpose of this is the opiate legal settlement funds. It's part of a multi-year payout from litigation brought by state and local government. It includes 5 nationwide opiate settlement agreements from big box realtors or retailers, and also from pharmaceutical companies. So, you know, the CVS, Walgreens, Walmart, and then other pharmaceutical companies. So they are starting to send money down to municipalities, because of the opiate crisis. And those have been affected. But so the town to date has committed $40,000 of that money to a teen talk mental health counselor at the middle school. It is through Kids in Crisis. It is a program with a proven track record that has spanned more than 25 years. It's a nonprofit agency. They employ master's levels mental health counselors in 18 middle and high schools across Fairfield County. These counselors are specially trained to identify and assist students facing various personal, familial, and academic challenges. They offer individual, group, and family counseling, as well as preventative education on crucial issues affecting youth well-being. So they've had this at the high school for a while, and it's proven to be effective and successful. So the plan is for $40,000 of that money is to pilot this at the middle school, to bring it down into the middle school for this upcoming year. The support was offered with the understanding between the town and the Board of Ed that we would decrease our funding, our support of this position, and then the Board of Ed would ramp up their funding in subsequent years if it was found to be effective. So that's where it sits now. There's restricted uses for this money. These legal settlements are 600 pages apiece, each one of the 7. So if you read through a lot of the narrative, there are approved uses for this funding. And the outlined uses include treatment, prevention, and other strategies. So, and staying in line with prevention is allowing that mental health service and support for young people. And the specific language uses including services and support provided by school nurses, behavioral health workers, or other school staff to address mental health needs in young people when not properly addressed, increases the risk of opiate and other drug misuse. And there's another statement in the settlement and approved uses of this fund that say support evidence informed programs or curricula to address mental health needs of young people who may be at risk of misusing opiates or other drugs, and build resilient skills. So, if you read through that, this position is in line with some of the strategies that are outlined for approved uses of this funding. So, when David was at the helm, the community foundation approached him, looking for some support and helping, to get this position going in the middle school. And that's really how it came to be.
Can I ask
Go ahead.
when you say the
Yep.
community foundation, what is that? What
The
are you?
Community Fund of Darien.
Oh, the Darien Community Fund.
Yes. Yes.
Okay. And this is only, I'm sorry, are you finished with your presentation?
Yes, go ahead.
Oh, okay. Sorry.
Yeah.
This 40,000 has already been committed. David already did that.
Yes, he did.
So that's not for us to approve or not. Or are we,
No,
are we supposed to retroactively?
What we're approving is accepting the money from the, I believe, is it fair to say it's from the state?
It is. It's funneling down. Yep. So the full amount to date is the 78,000 change. And what we're doing is the special appropriation is asking to just move that money so that it's accessible under program expenses. And
for the schools.
No, 40,000 of that is allocated for this position at the schools. And the remaining is to be determined, but it will be, it will be in line with what the approved uses are.
And Beth, just to be clear, nobody's making the decision to allocate this money other than it's really under the umbrella of the Board of Health. So all we're doing is accepting the money from the state. We're not micromanaging how it's going to be spent. But as Mindy said, it's pretty clear what you can and cannot spend it on. I don't think you can take a department out to Las Vegas for a trip.
Oh no.
And suggest it's, so I'm
Right.
kidding, but
Oh, yeah.
but I think it's pretty.
Well, actually, yeah, that like the Disney thing in New York City. No, I'm just questioning. I just want to understand because, we have a huge annual school budget, $110 million, I think it was this year, plus the, HHR stuff. And so obviously I understand the opioid settlements with Purdue and also the retailers, but this is like, it's interesting to me. That's just going to the these sound like very good programs, but I wonder why they're not more like available for the community or kids, students that don't go to Middlesex or Darien High School. Like it seems like you're giving, I don't know, it's just kind of an interesting funding tunnel as opposed to like a more.
I also think this is just the start.
It is.
This money's going to come in every year. Go ahead, Jim. You had a question.
This is going to be, and I just want to address that one statement that she made is that this is going to be over the span of 18 years where this money is going to start coming in and there's no real, I talked to, the finance director about how it's coming in and there's really no sequence to the money coming in, or is there a time frame? So, we're just, as it comes in, we're just dumping it into an account and then that it will sit there until it goes through all the appropriate channels as it has thus far. So we did take this special appropriations before the Board of Selectmen back in early August. It went to the Board of Finance. They also review and approve the special appropriation, actually August 20th. So, we'll go through those channels every time we move this money around. And for any programs that we build in the future, I will lean on my advisory board of health to help me decide how and where, we're going to get the best impact for our residents. And, any of those programs or things we might develop with that subsequent money is going to go before the Board of Selectmen. So it's not just going to be right.
Well, good. Jim, go ahead.
Yeah, just a couple of questions of clarification. So we're really not debating how the money is being spent. We're only voting whether or not to accept it or not.
Correct.
Is that correct?
Yes.
Okay. And is it $78,000 this year or $78,000 spread over X number of years?
This is what we've received so far, Jim, is my understanding. So
Okay.
it was, from spring and actually some of last year. So as this money
No,
trickles
that's fine. I
in,
mean, there'll be more coming down the pipeline of an undetermined amount, or we'll probably get to know.
right.
So the last thing I wanted to ask was, and I think you hinted at this, who's going to decide where this money gets spent? Is it the Board of Health with consent and approval of Board of Finance, Board of Selectmen? Who will be determining how this money gets spent?
Absolutely. All of those parties will be involved. And I think, at first I'm going to bring it to the Advisory Board of Health. So my board to talk about, where we see community need, get some input from our community partners, and really see where, again, we can get the most impact for the money that's coming in. And we'll allocate these funds when there's enough to do so. If we get, a small amount from one of them, we'll wait till it builds up to be enough, like it is now, 78,000, to be able to allocate that into other funds that we can actually use.
Thanks.
And I think, Jim, the state mandated that this money goes to each town's Board of Health. So it's not like our town said, okay, the Board of Health gets this money. It's got to come to them anyway.
Good.
Yeah, Lois?
So I have a question on the staffing. It sounded like it's mimicking the staffing that the high school is using. And I was wondering if the high school was still, whether they hired staff internally or they're using money, the Kids in Crisis, I think what you talked about. Or do they use a contract person, the same contract person that you're talking about in the middle school, or is it a different operation?
That I'm not sure how that's being funded. If that's I can't make an assumption, but that the Board of Ed is covering that cost.
Oh, it's not the cost, I mean the people. Where did we
the
hire
person.
people or is, I don't know if you know it, but is the high school using that same company kind of thing?
So they are. The Kids in Crisis is the position that's been used at the high school. And there was some stats, that they provided to David that I found in some records about, how many people they saw and, what kind of impact it was having, how many family visits they had, how many referrals they made. So all of that data is available, through the high school. So it was one person, and it was a summary of services provided by this teen talk counselor for a certain amount of time. And I don't know if they have a snapshot of the whole year that the program was in effect, because the report I saw recently was just like a quarter. But the profile of students that received counseling and what they came in for and that type of thing. So.
And the Board of Ed is continuing using this Kids in Crisis as their service provider. Is that true?
Yeah, that's my understanding. Yes.
Thank you.
High school.
Would you
So,
like a motion,
Mindy,
Mr. Chairman?
Sure.
I move that we accept the 78,000 and whatever it is as part of the opioid settlement. Period. That's all we need. That's the motion. We motion. I don't want to get into how it's going to be spent or who's going to decide. Motion is to accept the funds in the opioid settlement.
Second.
Okay. Good. All in favor?
Aye.
Aye.
Any opposed? Any abstentions? Okay, that's good. We're unanimous. Well, Mindy, thank you.
You're
Thanks,
welcome.
Mindy.
Yeah.
Do you
Good
want me
luck.
to nice to meet you all virtually. Mac, do you want me to hang on, or are you gonna go through the rest of your agenda?
No, I think we're good. We really appreciate your time. The
Absolutely.
next step will be at the full RTM meeting on Monday night. I'll kind of read a synopsis of what we did tonight and make note to the full RTM that we approved accepting this, and we ask that they do the same.
Okay.
It's I don't think you need to be at the full RTM meeting, but if I find out any differently, I'll certainly let you know.
Okay. Or if you need any information, let me know.
Okay.
Okay.
All right. Great.
All right.
Okay, thank you.
all.
Thank you.
Thanks, Wendy.
Good luck.
So, any announcements?
In fact, my
I don't have
announcement
anything.
is congratulations to Jim Cameron once again for publicizing the RTM vacancies.
Oh.
So if everybody could please get the word out, we'd appreciate it.
Have you seen a final tally from the town clerk as to how many holes there are in each district?
Yes, and she's going to give her a report on Monday.
Okay.
Because she, at the point where she gave a presentation at the RTM meeting, at the rules meeting, but then people still had the right to petition in, and a few
Right.
people did.
All right. Good. Yeah, I did a
Yeah,
quick interview with her about how to petition your way onto the ballot, and I think at least one person took advantage of that. So,
Oh, a whole bunch did. I know in
Oh,
our,
yeah?
yeah, some people got on and got
Yeah.
a bunch of people on that way so that they're,
It's so great you
It's-
get the word out, Jim. Thanks again.
hey, I want to get a full house in there, you know?
Yeah.
And by the way, Monday night, Lois will attest to this. Monday night will be not the debut, but the first time the RTM is meeting in the auditorium with all the beautiful new AV equipment.
Ooh.
You won't believe it. It's just spectacular.
you can actually hear everything.
Great.
Yes, you can.
No more feedback.
No, sir.
And then
Good.
you're probably going to say, wait, make it quieter. It's too loud.
Yeah.
Oh, that's good.
But we won't be using the screen because nobody has a video presentation. So that'll come on some later point. But on Saturday, they will be using, in the auditorium Saturday morning, they will be using the audio and the video
Yeah.
equipment.
See, Max, you could
Thank
do
you.
it first.
Excuse me?
You just need a presentation.
Yeah.
And Jim
Practice not.
has a feed in now, so he can pull it directly from the
Right.
speakers. So you can talk more about that, which is really exciting also.
Well, if you see it on the screen, you'll see it on TV 79. No thumb drives, just like an automatic feed, like in 206. But the microphone, there are more microphones in that room now than I have years left on this planet. Okay, they're a spectacular AV system, and Lois and Mike Wheeler on the tech advisory committee done
And
a
you.
spectacular job. Well, I had my self-interest from TV 79's point of view, but yeah, no, it's really going to be impressive. I think everyone will be really,
Oh, that's great.
and that's ARPA money. Thank you very much, ARPA.
Yes.
You know, so
And
you
there'll
want a
be
motion to adjourn, Mr. Chairman? I don't want to keep us
Sure.
any later, but
Yeah. No. It's
okay.
been a
I'm
good.
sorry,
good,
Lois. Did you
brief
want to say
meeting, but a
something?
constructive one.
I just wanted to say there'll be three polls, so that you can go to any one of the three aisles to speak when when the public wants, when the members want to speak, as opposed to
Yep.
Hey, just
Don't miss
off
it.
topic, but Lois, can I ask? I know the meeting is 8:00 Monday. Are we eventually moving to 7:30?
Yes, that's what we voted on in the last meeting, but it won't start in November when we start the new session.
Got it. Thank you.
Motion
Yeah,
to adjourn,
and,
Mr.
and
Chairman.
also I'll just one more thing. I don't think we need to meet Monday night. You know, we have our meeting
Correct.
scheduled at 7:00. I'll go ahead and cancel that.
Great.
Okay, go ahead, Jim, with your
Motion
motion.
to adjourn.
Second.
Okay. All in favor. Okay. Well, thanks everybody. Really appreciate
Thank
it. We'll see
you.
you Monday
Take
night.
care.
See you Monday.
See you Monday.